Hey everybody, welcome back to my channel. It's Dr. Alessandro. Please like and subscribe. And in this video, we're going to be talking about the Gagger patients. We all know them, and they can be really, really tough to work with. And we understand it's not easy. Having a very challenging gag reflex is a tough thing to live with, tough thing to deal with, especially when we're trying to get in there and do what we need to do. But it's not the person's fault. It's just a reflex, and they can't control that. So you do have to kind of take a step back, and whenever you encounter somebody like this, just take a deep breath on your own, and just realize they're not doing this on purpose. It's just the way they're wired, and so again, like I said, just take a deep breath, relax, and try to work out a system that maybe you can help get this person through the challenge, through the difficulty, and get whatever results you need from whatever it is that you're doing. Frequently, this is impressions or our molds. What we need to do, even scanning, folks, what we need to do in order to get a registration for a partial denture, a denture, crown, bridge, implant crown, Invisalign, regular braces, you name it. So whatever it is, it can be really, really tough. So that said, how do we overcome this, or how do we try to manage or circumvent this? There are a few ways. I'll just say some, and I'm going to invite all of you to please write in the comments section below what method you use, because I want to know more. And it's always cool to hear new different ways or tricks or tips so we can all help each other out. So what are ways that I've used? Well, one of them that I try, especially, when it's the summer, fall, the seasons where it's not the winter and lots of colds and everything, congestion all happening at the same time, I always let people know that it's a good way to handle this is to breathe through the nose. So they have to practice breathing through the nose. So take a couple of minutes and have the patient breathe through the nose and see if that helps, because it might. I'm not going to say that that's foolproof. It's helped me get through a few times, but certainly not every single time. So another way that I do it, I incorporate the breathing through your nose, but I also try to do a little bit of a distraction tip. So I do, hey, whoever it is that's in my chair, breathe through your nose and wiggle your toes. So it keeps their mind active on something other than their gag reflex. So if they're wiggling their toes, then maybe you're trying to take an impression, their body might be moving a little bit, so you have to kind of prepare for that. But if they're doing that, then their mind is off of the gag reflex, and you have a better chance of getting an impression that way, or getting a scan, registration, whatever it is. So that's another method. Another method yet that I've heard recently is putting salt on the tongue. I can't tell you how effective that is. And if somebody's got high blood pressure or things like that, you might want to be a little bit careful about, putting that Morton's all over the tongue. But if you happen to try this and it works, hey, great. So try the salt on the tongue technique, because I have heard that it has been, successful. So it's worth a try. And I would say if it helps the person get through the challenge of the gag reflex, then anything is worth a try, no matter what. As long as you're able to keep the airway safe, keep the person from gagging and causing that kind of a challenge, and you get your impression, registration, whatever it is, scan, that's what matters most. And as long as it makes it an easier experience for the patient, because believe me, I know it can be challenging. It's no picnic, it's no walk in the park. Having a gag reflex is pretty rough. So if everybody can win through that process, or at least it can be a lot easier for the patient, then all the better. So hopefully that helped. And again, if you have tips and tricks, please, by all means, comment, tell me, write it in the comments below the video so that people can see and maybe that can help them out. Maybe they have a patient for whom they've tried different things and it hasn't worked. So now they're looking for other ways. Your comments, your tips may be the tip that helps somebody get past the gag reflex and helps a team successfully deliver care. So, all right, hey, thanks again, and I hope you're all staying well and healthy.